Imagine this scenario. You are out to dinner with your family and you hear a cry for help. As a healthcare professional, you are going to see how you can help. You go running into the hallway and you see this unresponsive elderly person. Crowds of people around her. 911 has been called. EMS shows up and asks, what happened? What medical problems does she have? Does she take any medications? Does she have any drug allergies? Any recent surgeries? No one can answer those questions. EMS, feeling a little frustrated as they should be, starts with their very basic and systematic approach of the ABCDE. Let's think about a second scenario. You are at the park, your kids are playing, and this 5-year-old boy goes unresponsive. You're looking around for a parent to come running, and there's this teenage girl, a babysitter. You ask her, what happened? Does he take any medications? Does he have medical problems? You call 911. And she does not have any answers. She doesn't know. Let's think about a third scenario. We're going to move into the medical profession a little bit. In the emergency department, middle of the night, unresponsive persons dropped off at the doors. That's not an uncommon scenario. So we take them into the trauma bay, the resuscitation bay. We don't see any injuries. So you're wondering, what could have possibly happened? You don't smell alcohol. So you start your very systematic, basic approach, the ABCDE. Let's think about these three scenarios. All three of them could have had expedited care if we just had some information. Is there a heart condition? Is there something else going on? So what I am proposing is an intradermal Medi-chip. This Medi-chip will be injected just like a vaccination would be into your wrist. So when EMS providers or the hospital personnel find an unresponsive person, you scan this chip. There's a scanner. Every time you scan that chip, medical history comes up, medications, allergies, surgeries, any kind of pertinent information. Maybe you had a transplant. That's the basic information that would show up on this scanner, so you would know. So let's think about those scenarios. The very first one, we would have known she just had a heart attack and had some stents placed. Maybe she has a blockage that created this medical emergency. The second child at the playground, wow, he has a VP shunt. He may have had some kind of neurological emergency. Get him to the hospital and we can work on his VP shunt. The third one, he did show up to the hospital. Luckily, we had a scanner and we were able to see he's been dealing with some drug issues. Let's give him some Narcan. Maybe we can help reverse whatever is going on. That is what the basic concept of this Medi-chip is. This is a sterile process. Like I said, it would be injected right into your wrist. This might not be for everybody. If you have a healthy 5-6-year-old, this might not be something a parent would consider. If you have a child with any kind of medical condition, anybody, teenager, an adult, especially the elderly, this is something you very much should consider. It'd be something we'd have to talk to insurance about. Let them understand this will make the quality of care and efficiency go way high. This is something that we can measure. We can see how many times has this chip been accessed. This is what the basic concept would be. You could save lives just that quick thing with this EMS. Right now, the elderly will use the vial of life. This is a vial that's actually kept in the refrigerator. Anybody who's watching this, do you know about this? Would you think, oh, let me go look for this vial of life? It's an outdated concept. Second of all, many of the elderly and some of the younger people carry a medication card. So what happens if you're in the bathroom and you don't have your card on you? We would not know what information is kept on that. Many institutions use electronic medical records. So if you're in the hospital and you have ID on you, yes, that could be looked up and possibly very quickly. The very basic concept of this Medi-chip is you scan it and you have it. This is a 5-second process. This will help better healthcare in the fact that quality of care will be more efficient. This is something that people want. They want quicker healthcare. They want to be able to give this medical information as quickly as possible. Think about the elderly. Do you think that they understand all the medications that they're taking? Do you think that they know what is wrong? High blood pressure. Well, I'm taking medications that I really don't have high blood pressure anymore. This is a very common statement. With this Medi-chip, you scan it, they don't have to remember this. They don't have to remember, when they had their surgery and what the official name of their surgery was. Measuring this would be how often were these chips accessed. You could start surveying hospitals, you could start surveying EMS. The cost for this would be the scanning devices, they range about 300 to 500 per scanner. So this would be a cost for facilities, for EMS, but the cost definitely does not outweigh the benefits. The benefits are so much higher because the focus assessment will be focused on what conditions someone has. The chip itself, once insurances understand how this chip works, I feel that they would pay for this. Whether there's a copay on it, it wouldn't be for everybody. They may mandate you have to have a medical problem. You can't just have a chip because you don't have anything wrong with you. But I do feel that insurance would ultimately down the road pay for this. They would like this. This is something that will help the medical professionals. HIPAA, you will have to sign a consent. HIPAA will be involved. It is medical information, but it's on your body. Someone is not able to access it unless you are there with them. These scanners are only going to be held by medical professionals. So HIPAA is not going to be an issue once you sign your consent when you have it placed. This is Mr. and Mrs. Root. I am going to explain to them this new and exciting medical technology, the intradermal medical chip. This medical chip will be inserted into your wrist using similar technique like getting a vaccine. It's a sterile technique, and what this chip will do, it will have all your medical information. It will have past medical history. It will have allergies and medications. Mr. Root has known cardiac issues. He has a history of atrial fibrillation and is on blood thinners. Mrs. Root has had knee surgery in the spring and is preparing to have another knee surgery next week, which puts her at high risk for blood clots. So Mrs. Root, what do you feel are the positives about this concept, about having the medical chip inserted into your wrist?
Well, then I wouldn't have to carry the papers with the list of what's wrong with me or the allergies or anything because I'm allergic to everything.
Okay, and what do you feel would be the negatives about this concept?
Since I'm allergic to everything, I might be allergic to it.
Very true. Mr. Root, knowing that you have some cardiac issues and scarily you could be out anywhere and have a cardiac event, do you have anything to add as far as positive or negatives that come to this concept?
I think it'd be a positive because if you're unresponsive, you just drop. If the technology's there, they can come and scan your wrist and get all the information they need from all my medical records. That would be great.
Okay, and yes, the EMS personnel in the hospitals will carry this concept. So knowing the positive and negatives about this and how you feel, would you consider using this?
Yes, I would.
And Mrs. Root?
I'd give it a try.
All right. Well, thank you for partaking in this interview.